Uh,
2x. People are basically on
8%
4x.
RTA.
Everyone listens on 2x already, so we'll be on 4x. It's gonna
Yeah.
be next level.
Just shout our way through it as fast as we possibly can.
And actually, like, I don't trust when people tell me to listen to podcasts on 2x because usually podcasts talk faster. But with YouTube videos, I can't imagine watching at 1x. But like YouTube cadence is so slow.
A lot of podcasts I watch at 2.5. Depends on who it is though. I could never listen to somebody like Shapiro.
What's the
Sort of
thing?
too
I guess I
fast.
haven't seen many podcasts, but like when I watch like, or when I see clips from like Shapiro or fucking Joe Rogan or someone, like they're way higher cadence than YouTube videos. Like 1.5 is believable to me for like Joe Rogan stuff, but 2, fuck, are you really even listening?
You
Pulling
can
the
listen
speed.
to you can listen to some of it on 2, but I
Yeah,
don't
for
even
sure.
think it's like that enjoyable. A lot of it on like I guess it depends what you're listening to, but it's
It
like
all depends.
The
It's
main one
100%.
I used to listen to lots of audiobooks, and I never found someone I could listen to on 2 times. Like 1.5 was my max.
for audiobooks I usually listen at like 1.2 or 1.3.
Yeah,
Yeah, that's usually like the ideal, but I'm always too lazy to go and change it. 1 is usually just what I stick to.
It just depends on the reader. Some of them I would do like yeah, normal speed or some I do 1.1
Yeah.
if they're quick readers.
all right. So with all that fun stuff out of the way, we can just power through it. So today we're talking about healthcare. One of the another favorites of Canadians is to act all smug about our superior healthcare compared to America, and same with the Americans.
Wait, don't you mean the other way around? Isn't
No,
it a favorite pastime of Canadians to bitch about their healthcare and a favorite pastime of Americans to bitch about their healthcare?
no, it's the favorite. Everybody I know likes to bitch about like, oh, it's slow, but at least it's free, or it's expensive, but at least it's fast. Like they always big their own one up, even though they're both wrong. Um, yeah. So what we're gonna be doing today
People are
is,
way too positive in your life.
yeah, I don't know who
Wait, are
you
we
hang out
live?
with, but I don't know Americans who um like to say that they're like they either say that their healthcare is like great because Canada's too slow and shitty, or they like to say it's way too expensive.
Wait, have you? I've never heard an American actually compliment their own healthcare other than very like, what would the term be? Seemingly ostracized individuals in the conservative think tanks.
Yeah, but those are the types of people I know. Um,
You know,
so yeah, what we're gonna do is cover that. We went and did some research on those two topics, like Canada versus the U.S., but we're also looking at just general models of healthcare around the world, what countries use what, how successful they are with these different types of models, and just taking a look at to see if is there like a best model. So without that, do you guys want to give your thoughts going into this, Hubbards? How about you fire it up?
sure. I guess one of the main things I was thinking about going into this is like the US is strange, is in a strange exception in the fact that they're the only developed country that doesn't have some sort of universal system for their citizens. Um, Although they do have more of a universal system thanks to Obamacare. Obviously, that was kind of the point, was adding a public option that was made it much more accessible. And it, in that vein, the supporters of American exceptionalism, which I've also heard, I don't think it's as fringe as Price makes it out, is essentially that healthcare is in the US is the best of the best. You get what you pay for, basically, and
Just
that
don't be
shows up
poor.
in yeah, like if it yeah, there may be a certain percentage that aren't insured and they don't get as good as coverage, but the ones that do get coverage get the best of the best care, and that shows up in like survival rates or whatever, and shorter health wait times. That's a big thing. Like, oh yeah, like all the other systems just have exceedingly long wait times, not worth it. But then again, that get what you pay for also comes at super high costs, and that's like the main criticism of the American exceptional system would be just it's exceptionally expensive and not just like expensive per capita GDP. It's also for a lot of like on an individual level, I guess. It's the only system that really allows someone to get into like life life ruining debt due to healthcare concerns. No other like developed country would let you basically go bankrupt and be financially ruined thanks to healthcare costs, and that does happen in the U.S. system. And another thing I had thoughts about is you always hear like, well, not always, I guess, but oftentimes the notion of like healthcare being a human right gets argued about in these conversations, and I just don't really see that as like a useful piece of the conversation. It's like, yeah, human rights, very idealistic kind of thinking, and just doesn't really help establish what you should do policy wise just because you establish it one way or another as a human right. So I just think it's kind of a useless talking point.
Yeah, it doesn't actually help you build the healthcare system or not.
Yeah, my thoughts before were that due to the fact every developed country except America had it, it must be superior to have universal healthcare. But that I didn't really know what all the universal healthcare systems looked like under the underlying fact that all citizens had coverage, making it universal healthcare. Because in Canada we have healthcare organized at provincial level rather than federal, but presumably there are advantages to both organizational systems. And I also knew that Canada had the third highest drug prices in the world after the United States and Switzerland, and that we're still the envy of the United States for how cheap our drug prices are. But in Canada, it's still a negative financial burden on many people that has to do with healthcare that is being debated as to whether a universal pharmacare system should be adopted in Canada.
And as for me, I didn't have too much to add to that. The one thing that I did note going into this is, I guess this comes a bit more from the cultural milieu, not like a ton of my own in-depth research, but it does seem like in the United States there is some perverse incentives with a very organized, well-structured, and extremely profitable health insurance industry. And so anytime there's pushback to try to move them on to any sort of other system, that gets shot down immediately by a bit of political corruption in the form of kickbacks and stuff like that. But yeah, other than that, I felt that your guys' thoughts are pretty much sums it up for me as well. So do we want to jump into the models, Hubbards?
Yeah, we can just, like Price was saying, there, when you hear universal healthcare, that doesn't really do it justice because there's a lot of different models that countries adopt that are universal in nature, but the mechanics are quite different. So the probably maybe the most common, I guess, conception of what universal healthcare looks like is the Beveridge model. It's known as the Beveridge model, and that's what the UK has, which is a truly government healthcare system, public healthcare system, where the funding is all provided by government, centralized taxation pays for it, and the operation is also government run. So you're mostly going to see the employees and facilities being government property or government employees, and the costs are going to be controlled by the government, and there's going to be universal coverage. So yeah, that would probably be a lot of people's impression of what a public system is like. And that's used other than the UK, where it was pioneered by Spain, Cuba, Hong Kong, and also, interestingly, Veterans Health Administration in the USA. So that as far as I understand, the Veterans Health Administration is funded by the military and administered by the military or the Veterans Association, essentially. Like, it's done, both of those wings are done publicly. Another model is the Bismarck model, obviously coming from Germany, and that's employers and employees funding it through payroll contributions, deductions, and then you would have private insurance plans that you purchase with these payroll deductions. And it varies widely, I guess, by the country, how it's done. Like some have essentially a single insurer. I think France is a single insurer that does this model. In Germany, you have hundreds of different sickness funds with the ability to also use basically not-for-profit private insurance as well, other than the sickness funds. And then those pay for the healthcare when you go to use them. And aside from Germany, I think, yeah, France, Japan, Belgium, Switzerland, and also this would be in line with a lot of U.S. employer plans, where in the U.S. the employer payroll deductions are split, and you buy private insurance. Then another universal system that exists is national health insurance model, and that's basically the government pays for insurance for every citizen. It insures all citizens, essentially. And so the administration is usually private. So the doctors, physicians, they're going to be private individuals that are not government employees, and the hospitals oftentimes are going to be private, not-for-profits, or even sometimes profit-driven institutions. And you go into your, as a citizen, you go into your health service, whatever health service, you present your card, and then they bill the government, essentially, like they would bill a private insurer. Just the government acts as the sole insurer. Canada has that, Taiwan, South Korea, and that's also how Medicaid in the USA works. And then the last one, basically default option, out of pocket, pay for what you use. If you, pay as you go, whatever health care you need, you pay for it out of pocket at point of service. And basically the rest of the undeveloped world uses this: India, China, South America, Africa, and then uninsured, underinsured in certain areas. Obviously, the U.S. has issues with that, but lots of places do. Even
China's sort of an anomaly in the out of pocket, because like they still would fall under the same lines as underinsured Americans, wherein that they often have to pay 30% of their medical bills, but they do have 95% of their population covered by government insurance now. In like the last 20 years, it's gone from almost all out of pocket to almost universal coverage, but it's almost all underinsured.
Good point. Yeah. So that's basically your 4 broad categories. And again, countries mix and match a lot of the time. Like you just heard, the US has elements of every major model. But other countries also have a mix and match of different models. And the 4 broad models don't cover every scenario, right? Like there's going to be countries that have unique parts of their system that weren't really described in what we just said, but by and large, those are the 4 kind of basic ways that things are funded and administered. Do we want to jump into
the Canadian
system? Did either of you guys want to start on Canada? I just talked for too long.
Well, I'll go through your notes on the history of the Canadian system then, with the Canadian Constitution delegating most responsibilities for healthcare to provincial governments. So before World War II, Canada had a privately funded model, but in the 1950s, Saskatchewan began offering universal provincial healthcare, and that was incredibly popular, which led to it being adopted federally, wherein the government offered to cost share hospital and diagnostic services with the provinces so that everyone would implement this universal provincial healthcare. Then, once all the provinces had the legislation to bring in universal hospital and diagnostic services, there was a Health Act that consolidated the legislation in 1984. And in 1995, they further solidified the transfer payments from the federal government to the provincial governments in order to help them offset the cost of their healthcare system. And the 5 principles are public administration, that the provincial plans must be administered and operated on a non-profit basis. Comprehensiveness, the plans must ensure all medically necessary services are provided by hospitals, medical practitioners, and dentists working in hospital settings. Universality, they must cover all insured persons on uniform terms and conditions. Accessibility, must provide all insured persons reasonable access to medically necessary hospital and physician services. Portability, they must cover all insured persons when they move to another province or territory within Canada or when they travel abroad. There's some limit on coverage for services outside of Canada that may require prior approval if they're delivered outside of the jurisdiction. I think that's the basics.
Yeah, just to summarize that, summarize it and add some other things. Canada doesn't, like the federal government doesn't administer it all. It is each province runs its own system, and then it receives huge transfer payments from the government based on like proportionally how much they need to run the system. And then it mostly covers, so it doesn't cover stuff like pharmaceuticals, cosmetic surgeries, and then some other things, but it covers,
and also dentistry as well, which is like a problem.
So there actually is quite a bit of stuff in Canada that is not covered. So yeah, if you need your braces or something like that because your teeth are just doomed like mine were, you gotta pay for all of that. So in Canada, you actually have quite a large private insurance segment as well. That's still really popular here, to get all your pharmaceuticals covered, to get all of your dentistry covered, that type of stuff.
Pharmaceuticals, there are over 100,000 private insurance plans for pharmaceuticals in Canada, and over 100 public plans.
Yeah, you can get like there's some of it's on par with the States with crazy packages. Like my employer would offer a whole bunch of ranges that you could spend, and then you had you had a fund, and then using that money that the employer gave us through benefits, you can then pick your own plan. And some of them are crazy, like covers everything, but they're really expensive, like thousands and thousands of dollars a year per insurance plan. But then you could get pharmaceuticals worth $100,000 paid for if you had some sort of really rough condition that required really expensive drugs. But the other thing that I want to also make note of in Canada is nobody's the people in the medical system, like the employees, they are private. They are private employees. They are not employees of the government. Like in the UK, things are like the entire system is owned and operated by the government, whereas in Canada that's not the case. Like you set up your own practice and then you bill out to the government. So if somebody comes in to get their they need a drop-in and then get a prescription done, you as your doctor, you would take the invoice for that and bill that out to the government, to your provincial government, and then they would pay you for it. So it's all standardized rates. So like one doctor can't charge double what another doctor can. It's all controlled. That's how it works.
One pain in the ass that arises from that, if you're traveling and you don't have, I believe you should have your health card on you if you're ever traveling, because if you don't have your health card, the clinic or hospital will just charge you, and then you have to pay it, and then get into contact with your provincial government to reimburse you for the healthcare costs in the other province.
Yeah, it actually sucks. So if that's, if you
always have your health card with you.
Yeah, but just if you needed an ambulance ride, that might be tens of thousands of dollars that you have to cough up then, right? Like you might not be able to do that at all.
Also in Canada, you have to pay for your ambulance ride to an extent. I don't know what the max is on that.
Yeah, that is true. But yeah, again, just circling back, there it is important when you say like, yeah, the provinces do administer it. They're responsible for setting up the insurance side of things. So they don't yeah, like you said, the healthcare is actually administered by private entities by and large, but each province comes up with their own health insurance um, plan, right? And they just have to meet those. Price was reading the Five Canada Health Act principles. All the insurance plans that the provinces come up with have to meet those principles. So they can't just, they're not allowed to just come up with whatever plans they want. They do have certain guidelines that they and criteria that they have to meet when coming up with their plans. And you can see this with, say British Columbia. We had the MSP, and that changed a lot over the last 6-7 years in terms of how it's funded, how much it costs. Now they've basically got rid of the MSP, the medical services premium. It's no longer a thing anymore.
Yeah, so that was, you just had to make a small payment to a large payment. I think it was means tested every year for your healthcare. And BC was the last province to get rid of that, but it used to be relatively commonplace, and slowly every province has been removing that premium that people pay.
Yeah, so that has been like that's all part of the provinces administering the insurance side of things, but they don't actually, I mean, they're obviously involved in administration as well, but by and large the practitioners are private. So there's just not nearly as much government involvement in actual administration as most people probably think. Is there any additional points just on Canada before maybe
Well, I was
going
wanting
to
to talk a bit about the idea of universal pharmacare, because that seems to be the direction Canada's leaning for the near future in terms of adjustments to our healthcare that people would notice. And the idea of universal pharmacare is basically wiping out those 100,000 private plans and 100 plus public plans and replacing them with a single payer system in the same vein as our universal healthcare. And one of the reasons, the main reason to do that, probably the only reason really, is that as it stands, a lot of Canadians have financial difficulties with getting the drugs that they need, which then has a knock-on effect of them becoming more ill than they necessarily should have and having to use more hospital resources. So the hospital savings, they figure, well, this is a Canadian government report under the Liberal government, that they figured $1.2 billion in excess hospital spending due to improper pharmaceutical use, whether they didn't buy it because they couldn't afford it or they didn't even try to get it because they knew they couldn't afford it. And then 20% of households had a member who didn't take a prescription due to cost, which was 3 million individuals in total, which is about less than 1% of Canadians, but around 1%. And the average cost...
Whoa. How many? 3 million Canadians?
Yeah.
That's like
10%.
10.
Oh, is that? Oh, yeah. Math's hard.
Our immigration is liberal, but not that liberal.
Yes. So 10% of Canadians didn't take a prescription due to cost. And the average household would save $100 a year, which amounts to individual savings cumulatively of $1.4 billion in Canada if this plan came through. And the average business would save $750 an employee per year, which would be roughly $11 billion in savings for businesses. But with those savings taken into account as a negative on the balance sheet, the federal government would still have to pay an additional $15 billion to run this system over and above what is already paid cumulatively in Canada for pharmaceuticals. So it's not a obvious move to do. Otherwise, it would have been done. It's going to incur significant financial costs. With the one thing that didn't seem to be weighed, it's a hard thing to get a read on of rising drug prices, because drug prices have been rising consistently for the last 40 years or so. and a single payer system could sort of put a damper on those rising costs. So it might not be as big of a difference as $15 billion if you take into account that the cost for the rest of the system would have continued to increase. But it's still going to cost the federal government a lot if they choose to do this. And it's also a point of the NDP's platform. And now that the Liberals have adopted it, as they do, the NDP is starting to push for universal dental care as well as part of their platform.
We need the Liberals are going to snag the dentistry, and then the NDPs. We need homeopathic and chiropractic services universally covered.
Aromatherapy.
We need Eastern medicine universally covered. Like, it's just not acceptable that you can't go and get your chakras read for free. Like, that is it's just a travesty.
Well, do you know how much a bear testicle is going for these days? We need single payers to bring down those costs.
Yeah, that's interesting.
Yes, but
15 billion sounds like a rounding error for the Liberal budget, so not bad. What's another?
Not wrong.
What's another 15 billion on the deficit?
Tab? Yeah, on the tab, and what's another 10% in inflation?
One CERB payout. Like, why not? So yeah, I mean, it does make some sort of sense, I guess, and to go to a national insurance model, I guess, for pharmaceuticals. I don't see it being that bad of an idea, but yeah, maybe
Seems like it's in the works, but
Yeah.
it's not like a slam dunk. Like when I looked into it, I thought maybe it'd be obvious, but it doesn't seem like it's the obvious thing to do.
BC has already brought elements of that to bear in at the provincial level. There's BC has pharmacare.
It's like subsidized pharmacare, right?
Yeah, it's a means tested insurance coverage for BC residents. So I'd imagine that the federal government might want to gobble up that.
Yeah.
Votes.
Well, it seems to be the way it goes, like with the Saskatchewan system. It's like, oh, voters like this. And as usual, it's the Liberal Party that realizes voters like this, and therefore it should be done.
They do have a principle. It's just a very singular principle. Do whatever voters want to do with that.
Their mandate is to do what the voters want. I can't argue with that.
Yeah, very democratic. Do we want to just maybe introduce the U.S. system and then kind of compare contrasts after that?
Yeah, I think so. I think that works out. In the States, from what I saw, it's what was that model called that they subscribe to? Is that just
the U.S.?
Yeah.
The U.S. has every single model that you can think of, but their main model is the Bismarck model, essentially, because that's the employer plans. So most of their citizens would fall under the Bismarck model, because I think something like 75% of Americans are covered under an employer plan.
Yeah, and then there's a couple other ones. So they have Medicaid, Medicare, and a part of that is also Obamacare. And then there's also, like Hubbard's noted, there's the Veterans Health Administration. But essentially, like Medicaid in the States is insurance for low-income pregnant women, children, some people with disabilities, and seniors. So that's actually funded by both the states and the federal government. But each state runs it and administers it at the state-to-state level. And in 2018, it had 68 million people covered under it. So it's essentially like a means-tested additional coverage for people who are not on like an employer's healthcare or underinsured. And then Medicare is it's an additional insurance for seniors, and then a couple other like late stage like renal disease, other people who have disabilities who need additional coverage. So again, it's like a means tested thing to supplement Medicaid. And then they also had the Obamacare, which that is actually just a piece of legislation to beef up the Medicaid. That's really what it was. So it was pretty much saying that anybody who makes just like about 40% more than the poverty line income, so if they made, well, technically 38% more, they could get additional coverage under Medicaid. But again, it's state to state administered, so the state had to approve it, and of course some states said no. So it depends on where you are, if you're going to get it or not. And then it also created, Obamacare also created, it's also called the actual name is Affordable Care Act. It also created health tax credits for people from the poverty line to about 4 times the poverty line for income, which is like 20-some thousand, like 25,000-ish, something like that last I looked. It's not a lot, but they would they can use these premium tax credits to reduce their income for like it's just another way of kind of putting money back in the pockets of the citizens so that they can buy their insurance. And then it also added in a few rights, so you had to insure people despite pre-existing conditions, because a lot of the insurance companies would just say, you have pre-existing, like you're a smoker, you had this before you signed up, like, no, we're not covering you, and then you couldn't get any insurance whatsoever. So the ACA came in and put a stop to that, so they actually have to now provide that coverage regardless of what the issues, pre-existing issues were. Do you guys have anything else to add to the U.S.? There's quite a bit to add because it's obviously extremely complicated, but
I found some interesting statistics. The one that I think is most pertinent is that 10% of working age Americans are without health care, even after all of these changes to the system, which is still pretty substantial. And the number I saw for the amount of Americans that got health care through their employer was 50%, but this was looking at all Americans. And the interesting history of that goes back to the Second World War, where the government actually froze wages. You weren't allowed to give pay raises during the Second World War, but you were allowed to increase benefits. And so during the Second World War, employee healthcare went from 10% of workers having a healthcare package to 30%, because that became the incentive that you gave to try and draw workers to your company. And then in America, 28% of insured Americans are considered underinsured, which means they spend 5 to 10% of their household income on healthcare. 5% for poor people, 10% for people that aren't poor was the threshold, which is quite high, that being 28% of Americans. And that roughly the spending per person in America on healthcare is double the average of comparable countries.
Yeah, and just to add to your comments about the World War II thing, that's a continuing incentive, because health, basically payroll deductions for healthcare coverage are a non-taxable benefit. So you can increasingly cover your employees' health benefits, and they don't incur any additional income tax. So it's basically tax-free income or tax-free compensation to the employees. So it's better compensation per dollar spent for the on the employer side, right? Because they can either offer you a $1 raise, that's say you're at a 40% tax rate, it's only worth 60 cents to you, or they can offer you $1 in medical benefits, which is worth $1 to you, because you'd otherwise have to pay it out of pocket for additional insurance. So, it's just one way that they can give you more compensation than paying a higher salary. So that there's more and more incentive to do that, even now.
Yeah, that makes sense.
anything
Another interesting thing was that most Americans say that they are satisfied with their current insurance, which is a talking point of the people who are against changing the healthcare anymore.
that was Biden's talking point for during the primaries.
Oh yeah.
That
What
was
was
one
his
of
point?
he liked to say most Americans are satisfied with their health insurance, to shut up all the Bernie bros. He would use that to like stop those comments and criticisms.
Well, that is something when I just looked up briefly proposals for changing America's healthcare plan. Like, there's obviously the Bernie one, but that has almost no support, like in politics. And it doesn't seem like the Democratic Party has a single model that they would like to see the U.S. move towards that they can agree on.
Yeah, I have some outdated stats, but I mean they're still interesting. Like, again, in the U.S., basically doctors almost all work in private practice, and most work. This is probably still accurate, or sorry, 2/5 work solo in a solo practice, and almost all doctors work on fee for service model. Um, Another interesting thing, I think this is probably still true, is that most of the people without insurance are actually employed. So, because of Medicaid and other things, unemployed people are usually insured through Medicaid or other government things. And it's actually the working poor who don't have health insurance benefits, but also don't
Yeah,
uh, qualify for Medicaid or other things that are usually the ones that are uninsured or
it's
underinsured.
the people working like 2 part-time jobs or whatever because the employer doesn't want to give them benefits.
Or just working a shitty industry like a restaurant. The restaurant industry
What's
doesn't
the Ronald
basically.
McDonald care plan?
Yeah, they just don't, like, a lot of shitty industries don't offer any sort of decent health insurance, so a lot of those people just they won't choose to buy health insurance. So it's a lot of, because like the conservative kind of mindset a lot of times is like, well, if you're an unemployed bum, like, why do you deserve health insurance, right? Like, you're not contributing, why should you just get stuff for free out of the government? Well, under the current system, it is the unemployed bums that are oftentimes actually covered in some way, shape, or form by some sort of Medicaid or something else.
Yeah, but
And it's
if the Republicans, the money grubbing ones, had their way, they certainly would not be insured.
Well,
Well, but to
that
an
may be
extent, you
true,
got to keep the masses complacent. You don't want to be taking away their health care.
but the narrative that it's like all of these unemployed uh bums that are the ones without insurance and good, they deserve it, is just not true. It's like, no, the ones that are unemployed or under or uninsured are usually just actually the working poor who do have jobs, are working, they just have shitty options for healthcare. So I think that is something to consider about, like, the narrative and the perception is that that seems to be what's going on. Do you guys want to, like, do any point by point comparisons between Canada and the US?
Yeah,
Any
one thing I
standout
found
things?
to be really interesting um, was just how much how much Americans spend on their, or the country spends per as a proportion of their GDP. So it would have been 2019, I think it was. The U.S. spent 17.8% of its GDP on healthcare, and the Canada spent 10.4%. So
And the OECD average is 10.7 or
yeah,
so.
so America actually spends like a lot more of its total wealth produced on its own healthcare, despite like there being massive problems with people being uninsured. Like in the U.S., there's at least 26 million people who have they're underinsured or completely lack insurance, which is like that's a pretty sizable chunk of your nation to just have like nothing.
Well, I guess, like,
8%.
on the point by point comparison between the US and Canada, I think one thing that does stand out is going back to my point just a little bit earlier, is that it seems to be like the segment of the country, or the segment of the population that gets most fucked by the current system in the US is like the working class or working poor, because they actually have some sort of, like, they've something to lose, quote unquote, right? Like, a lot of the times, that they may not be doing great in life, but they do have, you know, a
A house
house,
or
yeah, a house, or kids, assets, possessions, hopes of a retirement. Like, they're not, the down and out destitute. They have some stuff, but they're really struggling. So oftentimes, healthcare costs as a percentage of their income is huge, And the big thing that I think a lot of people, like a lot of the stories you see that are the most kind of like tug at your emotion type shit is like the work. A lot of the time, it is like working poor people who um, didn't have insurance, but they got like bankrupted by health costs, or they were underinsured. That's a big problem with underinsured, is there's no out of pocket maximum on their insurance or whatever, and so they'll run into some sort of costly treatment and go bankrupt. And because they have something to lose, they basically lose their whole livelihood. They'll be, lower middle class, whatever, and they're forced into destitution and financial ruin from healthcare costs. And if you compare that to Canada, that just doesn't happen. Like Canada, you just don't have that. So I think that's like the one kind of segment of the population where there is a very stark outcome difference for a chunk of the population, where like you just stories of, you know, working class or middle class Canadians going absolutely broke and destitute
Losing
from a
your
healthcare.
home, losing your car, losing everything, and then you're truly good and fucked.
Yeah, that like going from, on track to a comfortable life, a reasonably comfortable retirement lifestyle, to absolutely financially ruined, it just doesn't happen in Canada, and that happens all the time in the US. And I think that those are like the stories that are like most attention grabbing. And it does make sense. It's like that is definitely like the segment of the population that seems most um screwed by the whole situation in the US. Like if you have a decent job, you're probably actually, yeah, like Biden would say, happy with your healthcare, right? You have a decent employer plan, you get good service, good coverage. You probably have, you know, in a lot of cases, you do have better healthcare than some of the other universal coverage places like Canada.
Oh yeah,
And then and if you're a senior, with Medicare, you're all like, Americans love their Medicare. Like they, seniors, and I mean, no coincidence, seniors are the ones that vote, so they're not going to, Republicans haven't gone after Medicare entitlements in any serious fashion.
yeah,
Um,
that would be the end of they'd destroy their entire voting block.
so if you're a senior, or you're really fucked in a bad spot, like disabled or whatever, you probably have Medicaid or Medicare, and you're probably covered, and you don't have much to lose anyway, so you're not going to be financially ruined by, there's either nothing to
Well,
ruin or you're covered.
and that is the basic premise of the Bernie Sanders idea, was to expand Medicare, was it not?
I
Yeah, and
think so.
I think that is why, like, maybe the Bernie um message is so hugely popular with a segment of the population, and it may not be a majority segment, right? But for, what did you say, 25 million Americans that are underinsured.
Or
And
lack it entirely.
yeah, or like there's tens of millions of Americans that are in a situation where they do just not have a good like, they are the ones that are left out of the equation, and they just do not have a good
It's
situation when it
I
comes to
think what
healthcare.
it kind of seems like to me is that's the cost of having. Okay, there's another like comparison to be made between Canada and the states and many other countries. In payer healthcare jurisdictions, a lot of the time you do have pretty big wait times. That can actually happen in the states depending on the area. But if you have a very good, but like if you have a very good platinum package for your insurance, you can get in to see specialists very quickly. You can get into like surgery very quickly, that type of thing. And it's in Canada. Like I know people who have been waiting for years to get serious surgeries here. They're not life-threatening ones, but life is very uncomfortable for them, and it's been 5 years, still can't get in, and that doesn't happen in the states. But it's just you need a really like that really good plan. So what I think that's kind of like the cost of having that type of convenience and that level of care up at the high end is that it just crushes this small segment of like they're not like it's not a tiny segment, but it's small enough that the rest of the country can kind of ignore it, even though it's pretty brutal. Um,
But also bear in mind that wait times are one of the areas where Canada consistently ranks significantly below the average of developed countries.
That is true,
Like,
yeah.
so
Like,
it's
but the
not just
comparison
that we're
between-
universal healthcare, like we're also one of the slower universal healthcare systems.
Yeah, we definitely, that actually is one of the big problems with it.
Yeah, I think I'm not necessarily convinced that it's a cost of having top insurance to screw that particular segment, right? Like, I could easily make the argument that, it's just kind of a haphazard result of kind of circumstance that led to the current U.S. situation. A lot of
Yeah,
it,
you
I
could
don't think
fix it so it wouldn't be such a way, but yeah, I think that's a better way of putting it, that it's just kind of how it's worked out. It's not like a direct, you would always
like
get that exact same outcome every time, but
like you could I think you could imagine another American history that leads to the bottom, say 10% of the population getting like no coverage or no attention, right? And if you look at a lot of countries prior to universal healthcare in, say, can't even Canada, England, whatever, that was basically how the system worked, and that's how even developing countries now work. Um, if you're rich, you get good coverage. If you're it's basically a sliding spectrum, right? The more money you have, the better you're served. America is a weird circumstance where it's kind of like they have some safety net where if you like are kind of really destitute and fucked over, you're actually captured by the safety net. And if you're rich, you're obviously good to go. But if you're in this like gray area working poor, you're fucked. The America system seems actually kind of unique in the sense that that particular segment never got any attention from government or whatever, and got never secured basically proper health coverage. And that's why I think there is a percentage like it. I would say like it. I don't think it's a coincidence that you don't have a lot of you know senior citizen Bernie bros. It's a lot of young people in the exact type of
working for
probably
Starbucks or something like that.
or gig economy workers, etc. Like that's your
Yeah.
primary Bernie bros are your like your 20 to 40-year-old kind of sporadically or unstably employed individual, and that makes tons of
Vox
sense because
freelancers.
he's saying let's give healthcare to this one segment that just consistently gets left out of the
Yeah.
equation.
And like I said, it's small enough that the general voter base just ignores it for now. I think it'll start to grow, but who knows?
Yeah, it's interesting because seniors who are the most consistent and large voting bloc are covered in the U.S. by Medicare, so they're not very up in arms about it all. Anyone kind of middle class and above is not going to really give a shit
Yeah, you got a
because
good
they have an employer plan that they're probably relatively happy with. And then a lot of people that are in like very bad circumstances, like disability or whatever, are also covered through Medicaid or whatever, and they're not that up in arms. It's just this one little, well, it's not a little, but this
it's
chunk
like
of a
probably
few tens of millions.
10% ish. That's what it seems to
Yeah,
be.
which is big enough that it makes noise, but not big enough that it wins.
Yeah, it's actually gonna push.
primaries apparently.
Yeah, exactly.
Um,
Can't break that what was it, the Idaho firewall or whatever he was calling it. I don't remember. Iowa, I think. No, Biden. Remember when he was campaigning? He's like, no, it's gonna be fine, because it looked like Bernie was gonna win, and then everybody thought he should just drop out.
Well, then every centrist candidate dropped out, and they formed the centrist blob that was headed by Biden.
Except for, and then Elizabeth Warren stayed in just to split the vote. Those good times. Yeah, I don't know. It's hard to get like good data, or I guess it's just really hard to comprehensively measure healthcare performance because there's so many different metrics you can choose. But certainly, I would say at least the things I looked at, Canada does consistently score above the US in general. Not a ton higher usually, but they do, most rankings do put them above the US. And I mean, that, again, it's hard to say because there's so many metrics you can choose. And I would say almost all ranking systems and measurement systems these days are going to include some sort of affordability slash coverage, accessibility and universality of coverage metric, which always is just going to hurt the US time and time again. So if you are an American, or if you do like the American system, you might be perfectly happy to take that trade-off and say, well, on 8 out of other, say health outcomes or whatever, we win 8 out of 10 times, good enough for me. I don't give a shit about the accessibility. But yeah, I do think, like Price was saying in his thoughts before, it is strange that the only other country that kind of works similar to the US of the developed countries is Switzerland, basically.
On the topic of rankings, I found a coverage, basically a defensive like Canada consistently ranks mediocre to average among developed worlds. And their main defense was that there's different bureaucratic systems in each universal healthcare, and that like the rankings don't really have room for weighing these different bureaucratic methods. And two examples they gave were that Canada only hospitalizes severe stroke patients, and that leads to a higher percentage of mortality among stroke patients in Canada than in European patients because they hospitalize non-severe patients as well. And so that just makes us lose in that metric if it's counted. And that Canada counts significantly premature and underweight babies as infant mortality, whereas many countries have a premature date or an underweight level that they don't consider the baby an infant mortality. So that means Canada's infant mortality looks much worse than it otherwise would, because when we report our infant mortality, it includes a bigger net of dead infants in some countries.
That's really interesting.
Yeah.
Like what I saw in terms of Canada's performance didn't cover those types of health outcomes, and it still scored pretty mediocre. Just like spending, like it was like the big analysis that I looked through was healthcare spending, as like generally that was like the main look, and then outcomes for like acute care beds and stuff like that. And Canada definitely ranks out of like the developed world. It is definitely in the lower quartiles rather than in the upper quartiles. It spends a fair bit more of its GDP compared to the average. Like not a ton more, but it's definitely a bit more expensive in terms of that.
I thought we were almost right on the money for average.
Depends on the report you look at, but the one that I'm looking at is the 2017 Fraser Institute report, or 2015.
Oh man, that's unlucky.
It is the Fraser Institute, so
and it was made during a time when the Liberals were in power, so it's basically like Trudeau personally shot me when I went to the doctor. Showed up and he assaulted me.
This one seems to be like reasonable. It doesn't look like Canada scores like way below everybody else, but it's a little bit more expensive, and you get like less there's like less acute care beds and stuff. There's less acute care beds and some of the other services like MRI scanners or MRI units, CT scanners, stuff like that, just per population. So like those numbers are pretty, like you can't really fudge them, but it does sit in line with like the mediocre performance that Price.
I guess you could say that, like, I don't know, Canada's performance is good if you consider the whole world.
Yeah,
it's average if you consider only the top whatever 50 countries or whatever that are developed countries.
Yeah,
Like,
that's kind of the takeaway I got from looking at
Oh,
various reports on Canada. Is it's
the two I saw put Canada at ninth place out of 11 in the Commonwealth report, which I wasn't entirely clear, but I assume that meant the Commonwealth countries. And then it put the WHO put us 30th, but that included all 191 countries, of which like 6 are literal cities, so more like 24th out of real countries.
you're erasing those cities' lived experience.
Well, I mean,
Per
you can't really like. It's not fair to compare a city to a country. Like they have one hospital and
no,
service
man.
200,000 people with it. Like
If
what?
I've learned anything from COVID vaccination rates, it's you can definitely compare places as tiny little bits of land to entire countries and call it good. Like
Well, everyone
Malta,
knows San Marino just had it way worse than Italy.
Malta got vaccinated faster than China. It's surprising, I know. Like you would think that China, with their economic might, would have been able to vaccinate faster than Malta, but no, they
Just
fell
hate to see
behind.
it.
Yeah.
Maltese exceptionalism.
Yeah, on that same WHO report, the US was 37th, for some context, and the number one spot on that was France.
Yeah,
And
France typically ranks in the top when
y-
that I've
you
noticed.
really like there's definitely correlation between rankings, obviously, like, but there's doesn't seem to be any um, perfect agreement between what's the best healthcare. Like I've seen various sources that are different policy analysts and etc. Norway, I've seen Norway claimed.
Yeah, I
Netherlands,
saw a couple with Norway.
the Netherlands, I have seen, I think, one or two even of the UK, the NHS being claimed as the best, or and then sometimes the and then sometimes like the UK wasn't even in top 10 for the WHO report. So it doesn't seem to be like a big consensus. And I think that goes back to the fact that there's a dozen different or 2 dozen different criteria you can score healthcare systems on. How do you weight them properly? Well, that depends who you are. If you're a government, you might have a very different set of criteria in mind for what you value versus what an individual in that country values, right? Like governments might be a lot about keeping the cost down, versus an individual might just care about quality of care, wait times much more than the government does. So it's I think if you were to choose what you want as an individual, you have to consider the criteria that they're using, and you're probably not going to have an incentive alignment with, say, the government or other parties that have a vested interest.
Well, with the UK and the NHS, I think the only time they can score highly is when pharmacare and dental care is considered, because since they pay for those things, their healthcare looks bloated if that's not included in the metrics.
Yeah, and to many people, that actually makes a huge difference, right? Like they would probably rank that they would weight that much higher, thereby pushing up the UK's ranking. Just like Hubbard said, it really depends on who you are and what your priorities are, what metrics matter to you the most, and that is something I've noticed too. Is the top ranking, the various sites that I looked at for the best rankings in the world for healthcare, it's such a it's a toss up, but there is a number of countries that always sit within the top 10, top 15, and that's usually France, the Netherlands, Italy is usually in there quite a bit. What were the other
Norway.
ones? Norway, yeah. So I think there are some commonalities of what makes a good system and what makes a worse system. Clearly,
Well,
like being poor as a country is just like game over. But
Yeah, I was going to say, I think it's worth mentioning that the worst case scenario is spending less money on your healthcare, because there's been a few economic analysis in an attempt to determine the relationship between GDP and healthcare. And they've found, at least to a small extent, that spending more on healthcare should be bolstering GDP, as well as the obvious one that countries that have a higher GDP spend more money on healthcare. So that the one I saw for Britain, they figured that about 30% of the growth in GDP could have been attributed to better health and nutrition during 1780 to 1979. So, I mean, it seems pretty speculative, probably, but it's a pretty strong relationship of health increasing and GDP increasing, if true.
Well, it does make sense. Like, I mean, we talked about even in previous podcasts on intelligence. It's hard to make intelligence higher, but you can screw up intelligence by not having proper nutrition and not having like, basic healthcare stuff like, even parasites and etc. Ringworm is a big one
Yeah.
that reduces intelligence, etc. So, and intelligence is a huge, predictor of improved productivity, essentially. So, if you're going to spend money on healthcare, I think there's probably going to be a point, diminishing returns. But a
Yeah.
lot of the early increases in spending on health is probably going to reap outsized rewards in terms of increased productivity.
Yeah,
And
with regards to that, in developing nations between 1970 and 2000, there was a study that attributed 11% of income gains to lower adult mortality rates.
yeah, that's not insignificant, right? So I mean, there is something to be said about going into kind of the theoretics of it. A lot of people suggest that human tendency is to underspend on stuff like health because it is not just
Salient.
yeah, it's not status displaying, right? Like you do not get any status reward or social reward for displaying your healthcare costs or like what you spent on healthcare, right? So people are social creatures. They like to flash their wealth. That's where keeping up with the Joneses comes from. Healthcare is not a very good way to keep up with Joneses. Therefore, people will often underspend on healthcare in what would be in relation to what would be optimal for their quality of life and society as a whole. So a lot of the time, universal healthcare systems, I think, are good in just the sense that they bake the costs into they make them mandatory, right, for citizens. They put them on payroll taxes in a lot of cases, or just centralized taxation through income tax or whatever. And you have no choice but to increase your own spending on health because the government says so. And I mean, that obviously a lot of your libertarian arguments coming out of the US, that's exactly why they hate it. That's why they hate universal health care, right?
Yeah,
Like
but
you
you
should
know
only
for a fact that if they didn't have that and they weren't forced into it, they'd all be like massive drains on the system.
Well, talking to any libertarian is just an exercise in making yourself
Futility.
dumber. But yeah, yeah, I think I think the libertarian argument falls apart given basically modern morality, essentially, right? Like
You're just not gonna let
we
them die on the side of the road.
exactly like if you wanted to make healthcare a total free market and a total opt-in or opt-out, decision, and you said, if you don't want to buy insurance, that's fine, that's up to you. But if you get sick and you can't afford it, we're just going to let you die. Then that works because that's how other insurance markets work. Because well, yeah, a lot of the time, some insurance markets work like that, but y- y- where if you opt out, you're just left to your own devices. Well, we don't, because of modern morality, we don't let people die on the side of the road if they opt out, right?
Yeah, they're
So
always taken into the. There's so many stories out of the states of people taking in those hospitals taking in those who have no insurance, and they take care of them anyway. They've gotten hit by a car or whatever. They don't have insurance, and they don't just kick them out of the hospital. Like, I guess that might happen in some cases, but a lot of the time that's not what happens. Is they do it.
have to render them emergency care.
Yeah,
So
exactly.
basically, what happens in the U.S. is if you're not insured and you come into the hospital, like this is why homeless people oftentimes will cost tens of thousands or hundreds of thousands of dollars a year in medical costs in even, well, not even in just the U.S., but all
anywhere.
over the world, because they will be brought in for emergency care, and then they will be, especially in the U.S., they will be discharged rapidly because they're not insured. Therefore, they're not bringing in any money, so they get discharged before they are optimally healthy or optimally taken care of, and then they just wind right back up costing the hospital or whatever more money anyway. But again, that's exactly the point, and I think that's why it's the same reason that most places enforce mandatory mandatory minimum amount of insurance for, say, cars, right?
Yeah, otherwise everybody would cheap out, not do it, and then it would just be a mess. People would crash all the time. They'd have no insurance. Everybody would be bankrupt from being sued, or like whatever else, like all the lawsuits, and it would just turn into an extremely expensive mess.
Well, I think it's because there's a lot of if you know that the morality of your society is such that they're going to take care of you regardless, like you're already essentially insured.
Yeah, exactly.
You're going to opt out of the nominal insurance and just say, well, I'm going to save $1, and worst comes to worst, some bad shit happens, and then I'm just going to get bailed out anyway, right? And so it's the same, argument of, yeah, it just doesn't work, because then if you just let people off the hook once the consequences happen to them, then there's no reason they'll ever opt in the first place, and your whole private insurance market falls apart. So that's why I think the libertarian argument is complete nonsense in the face of the fact that we know we're not just going to let people die on the street. Unless you're a libertarian arguing from that principled point, like, I support health insurance, or like totally private health insurance model, and I'm totally willing to advocate that, we let everyone who's not insured die on the street. Well, then your system is just completely unsound.
Yeah, and it's just completely unworkable.
Yeah, you're smuggling in another assumption, which is that you'll let people die on the street that aren't.
And like our society, there's just no way. Like in the States, in Canada, in the Western world, that's never gonna happen. Like it's just
as a libertarian, you're free to make the argument that we should move to that way. It's just you're probably going to do even worse on elections than you have been, which is so bad it's not even worth mentioning their performances. So
yeah, they pick some real fucking winners the last couple of times.
Like there's no surprise that they get basically no electoral support, but I mean, if they were honest about their arguments, they'd get even less. So, but yeah, I just don't see a system. I guess that's my argument of why a universal system is kind of just necessary in developed countries in this day and age, because of it's a better match for the reality of our kind of more moral reasoning at this point in time. It's just, we're going to basically run a de facto universal system, which again, in the US, they do run basically a de facto universal system to a certain extent. Like you can get emergency services no matter what as a person, even without insurance. Therefore, like, why don't you move towards a de jure universal system so everyone is actually contributing, or the framework for more universal contribution is there? I don't know if you guys have counterpoints to that or thoughts about that.
No, I agree.
I pretty much fully agree with that. The American system is bizarre in that sense, that I'd heard of the emergency thing, and it just everything you said just doesn't make a lot of sense. How Americans claim to not have universal health care and yet treat everybody.
Yeah, and that's not to say that people get universally equal treatment, obviously, but they get some sort of treatment, and a lot of the time, um, uh, it ends up costing you more because you don't do the preventative treatment and the preventative work. And I think this is coming back to what Price mentioned earlier about the pharmacare. People opt out of taking medication that they should have taken because it costs XYZ, and then down the line they end up with something far more serious that puts them in hospital and costs taxpayers significant dollars anyway, right? So I think there's the same argument in the US where it's like, the uninsured people that are doing have health problems and stuff are getting just the medical bare minimum, and their problems don't get fully solved or fully resolved, and then they just wind up in a revolving door in whatever hospital, and it ends up costing the institutions more than just doing the proper care of those people from day one, right?
Speaking of preventative care, I think that's a good segue into some other approaches towards universal healthcare that incorporate more preventative care if we're done with the US.
Yeah, I think we can move right on.
So the one that I looked into a bit that does a preventative care to an extent is Japan, because every year, every citizen gets a health checkup with a doctor. And the real obvious result of that is they get a weight test. And if they're overweight, they get a plan on how to lose weight from the doctor. And also the company is encouraged to help them lose weight if they're working for a company, because Japan has the system where the company pays for the employee's insurance unless you don't work for a company, in which case you're obligated to pay your municipality for your insurance. So that is sort of a preventative measure. And in a lot of cases, the good outcomes in Japanese healthcare, in spite of relatively low funding and low numbers of doctors, are attributed to a generally healthier population, which some of it is societal, but they also do put this effort into preventative healthcare, which generally would lead you to have a healthier society.
Yeah, but if you do that here, you're just going to be a fat shamer, so no good.
I believe roughly 3% of Japanese are obese, which is by far the lowest percentage in the whole world.
So basically what you're saying is the whole Japanese government is a bunch of shitlords.
A bunch of fat shamers.
Oh man,
based beyond belief.
It's a huge cost to healthcare as obesity.
As a little tangent, that's one of the things that just gets me going about COVID is nobody talked about losing fucking weight. Like I had a couple friends who are pretty overweight, and they immediately, because they weren't complete like dumpster fires of human beings, they figured out like, oh shit, like if I don't want to get really sick from COVID, I should not be as overweight as I am. So to the credit, they lost quite a bit of weight. It's really impressive. But like there's been no talk from most governments that I've seen. It's just like, God.
No, there's a Canadian federal initiative to get Canadians moving or something, and I've heard about it once.
Yeah,
they're doing a good job of this initiative, and I think they started it over 2 years ago. Because the main problem facing Canadians is lack of activity, and by extension, like being obese.
Well, there's a research.
But there's also people that aren't obese that are also facing health difficulties from a lack of activity.
Well, one of the things that was noted with COVID is that even if you're overweight, but you do like 2.5 hours of somewhat brisk physical activity, that in and of itself is protective, even if you're still overweight. Like just the exercise alone is good. So even if you're still...
Well, that's something people don't understand, is that exercise on its own axis is beneficial, and weight on its own axis is like being proper weight on its own axis is beneficial. So the best possible health condition you can be in is obviously healthy weight and exercise regularly. But You can mix
Most
and
people
match.
would rather just try to lose the weight and then not exercise, and then consider it a job well done.
To me,
Except then they won't lose the weight in the first place.
yeah, that's funny because I think the harder one to do is the food, but maybe that's just
Yeah,
me.
for me, for sure.
Well, I would say it's harder to do, but I would say that's what most people try to do. Like that's diets are just such a huge force in our culture.
True, I guess
Yes, rarely successful.
there's more money in it, right? For the diet industry, so it's pushed more. Not
So that
not
yeah.
not as
So
much
I'll
money.
go into a few more stats on Japan. One of the interesting things is that probably partially due to this annual doctor visit, but they see doctors twice as frequently as Europeans, who presumably also have universal health care. And this is with a, what's the term? Where they have to do a copay. So they don't have quite the incentive of a place like Canada where you just get everything free, no charge to you. They do have to do there's a maximum payment on their visits. And they spend 3 times as long in hospital beds as the average in the industrial world or developed world, while they still have an average spending of their GDP, although I believe that's out of date. They're now slightly above Canada in GDP, so they're definitely above the average. They're behind France, though, still for spending.
Did you ever look into it or see? I wonder if that's similar to Taiwan, where Taiwan has really Spartan hospitals, and in addition, a lot of the like what we would consider hospital services done by the hospital, like feeding and some like care, is expected to be provided by the family rather than
Well,
the
so yeah, so Japan and Taiwan are like the opposites in that sense, because Japan spends way too much time in the hospital and they get too much service there, which is an issue that the government is grappling with now, in that they're trying to encourage more home care. So I imagine they're taking Taiwan as a model and trying to push people towards their homes. But the big problem in Japan that I'm not sure exists elsewhere in the world to the same extent is the number of single family households. So doing home care still requires the Japanese medical service to send a nurse in most cases, because they have so many people that don't have a family.
Fucking rip.
And so their problem is basically the problem the rest of the world is going to face inevitably, that their population is aging and they aren't having any young people. So it's becoming incredibly
Better get
burdensome.
nurse robots.
I was gonna say that
Yeah.
Japan's just fucked because they're gonna have to deal with it before Boston Dynamics solves the problem.
Well, they always get the memes about Japan being tech savvy, and then you go there and they're like still stuck in the 1980s. They've got 10 guys in a lab making all the cutting edge technology and never applying it to the real world. So they only have 2/3 of the doctors that the average industrialized country has.
Didn't your note say something about them still doing shit on pen and paper for like?
Yeah, well, basically, COVID is the first time they've ever stopped to consider that maybe they should cease using fax machines as the most up-to-date way of transferring information between hospitals.
That's not unique, though. That's unironically not unique.
I know, that's what I found in other places as well, is that generally speaking, hospitals do not communicate but through fax. But Japan is starting to consider to use digital. The one thing that Japan does that other countries don't necessarily do still is a lot of paper record keeping, because the reason fax still seems dominant between hospitals is that they don't have a unified digital system, so they can't send digital records even if they keep their records digitally. So if one hospital wants to send their records to another hospital, they have to print off the record and fax it. And then the other hospital has to have an intern or somebody read that and then input it into their digital system, because the two systems don't talk to each other. Whereas in Japan, they literally don't have a digital system to use. They just fax it over and then they put that in their filing system.
Well, there's also another reason for
backup
for fax, and like, I don't know, like it depends. So in government, fax is used a lot as well, and the main reason is security issues. So the government, a lot of industries and areas haven't figured out how to send documents between institutions or from individuals to institutions in a secure method other than fax. Fax is that's where
Private
they
industries figure this shit out, though.
they stopped innovating, and that's where they stand, is fax.
Yeah. Well,
They're trying
that's
to
the kind of the thing. Fax is the minimally acceptable standard, and that it does the job, I guess.
Well, yeah. So in government, between government, there's encrypted email and stuff, but it gets a lot trickier when, say, I could imagine it, especially in, like you were saying, between different systems. You don't have a universal encryption system available.
Yeah, so like the EU is attempting to implement a universal healthcare system that would allow for these encrypted digital communications and usage of one standardized form. So, I mean, presumably that will go somewhere because it just makes too much sense not to. But who knows how far away
Well,
that
yeah,
could be.
I think we're 10 years away from having that in a lot of different industries. It's just I think a lot of people who don't use or who don't like deal with secure document exchange don't realize that fax is still the standard in a lot of areas.
Yeah.
They couldn't even comprehend it, like, because email, right, is so easy, or electronic document exchange of whatever sort, and that's just not the case for many areas. They're still on fax.
We do
Just-
it.
yeah.
Yeah, we do everything via
But yeah, so
online, though.
the
It's all gotta be super secure.
The
So
OECD rankings put Japan last place for management and use of data in healthcare. So, like, even among all the barbaric healthcare systems, they're far and away the worst.
Well, I know Canada, where there was stuff about documents being faxed in Canada during the pandemic, and
Mhm.
people absolutely mind blown that fax still exists. And it's like, just go into pretty much any government or whatever secure
Yeah.
government data exchange, and there's going to be lots of faxing going on.
Even like legal documents between companies and their lawyers are often faxed for that same
Exactly.
reason. Their goal with digitizing in Japan, if they can manage to do it, who knows, is to be able to implement a pay for outcome system rather than a pay for service. So right now, as in most places, I believe, when the hospital performs a service, they get paid for it. But in Japan, and I think this is still common, but not as common as getting paid for the service, they set the price that they pay for the service in Japan so that the hospitals can't charge more for a service than what the Japanese government says that service is worth. So they get a lot of cases of the hospitals running multiple diagnostic tests that are unnecessary, finding flimsy excuse to do CT scans and such, just so that they can charge for using that CT scan.
Milk patients, basically.
Yeah, and therefore they have the highest number of CT scanners per capita in the world. And that's kind of one of the bloating areas the government sees where they've got inefficiency in their healthcare system and they're trying to drive their costs down because as their population ages, their costs are just starting to skyrocket. And then speaking of aging populations, which is something almost every developed country is dealing with, there's not really a good way to finance healthcare for dementia patients, but many countries have started to implement a long-term care insurance that you have to pay into at a mandatory age. So in Japan, it's 40 to 65, and that is based on a system in Germany. And you pay into it at 40 to 65, and then after 65, you can get benefits for dementia care. So in Japan, you have to copay, you pay 10% of the costs of your dementia care, and the government pays the other 90%. And that was applicable to 15% of people over 65 in Japan in 2018. And basically, they said there's no way this is going to remain financially viable in the near future. So they're trying to find ways to make more money, squeeze more money out of their healthcare system in various ways.
COVID-19.
Yeah.
what was that?
COVID-19, just kill everyone.
Just
Kill all the
yeah.
old people.
And one of their deputies did say old people should just hurry up and die, which for the Japanese is very incredibly blunt. For almost any Western country,
I was gonna say-
that would be incredibly blunt
Classic,
as well.
respect your elders.
Yeah, but it's like, yeah, the Japanese are generally considered to have a great respect for age, and this guy wasn't having any of it. And the Dutch have had this sort of mandatory long-term care insurance since 1968, and they started slashing costs in the mid 2000s because they couldn't afford what they were doing, and they've managed to string it along since then. And basically, it's a problem the entire world is having to face, in places like Canada or America seem to sort of just have their head in the sand. For Medicare, it covers all your public health, like doctor's fees, but only 100 days of skilled nursing care. So that's not going to get you very far if you're going to live 10 years with dementia or something.
That's why we literally need the robot revolution.
Yeah, and then Britain, the NHS doesn't cover any social care, which is apparently, according to the article, a common misconception in Britain that the NHS covers everything, because they do cover everything anyone needs until is basically dementia care when you're 65 or older. In which case, you have to pay out of your own pocket until you're down to $30,000 of wealth, and then the government will take over and cover you, which includes selling your house.
Fuck.
Well, I guess it does make sense.
Yeah, but Britain is looking at the sort of system that Germany and Japan have as potentially implementing something along those lines.
I don't know. I really do think the aging problem will benefit a lot from automation and robotics. Like, I do think that's going to be.
Yeah, and one of the big things with that is basically systems that can also reinforce better behavior in people with dementia, because a lot of times, like, simple psychological behaviors interventions work well with those sort of patients, but you don't have many skilled behaviorists in residential homes, like looking after the patients, and it requires almost sort of constantly interacting with them and feeding them back positive reinforcers for behaviors. And both, basically, you could have a cheaper care for the elderly as well as a higher quality of care for dementia patients with automation, I believe.
I think it's just inevitable. Like, and I also like the other thing to consider is just freeing up workers from other sectors that are
Being
labor intensive, right? That are being automated, and more people going. Because I think there will be a shift out of like, say, retail and stuff, and you might see people shifting more and more into human care, right?
That's one of the interesting things in the Netherlands, now that they've seemed to have abated their financial crisis of caring for the elderly, is that they foresee basically the roadblock is no matter how much money you have, there's only so many care workers.
Yeah, exactly. It's like at some.
I do think it's tricky because you have to have standards for care workers that are just higher than say a lot of other industries.
Yeah, like the level of, like, talent and intelligence and just, compassion and whatnot required of a care worker versus that of somebody who works at like Victoria's Secret or something is just massively different.
Well, but in Canada, even provincially, we saw a stark contrast between long-term care homes in each province, because they're all run provincially, with BC setting the standard for Canada to the point where BC's care home guidelines for dealing with COVID became the federally advised guidelines for all provinces to follow.
Because Quebec killed all their old people
immediately. Quebec and Ontario had effectively, they had part-time workers, so they didn't give them any benefits, and they would share them between long-term care homes so that they'd work 40 hours a week, but they would only work 13 hours a week maximum at any individual place, so that they'd never had to get benefits. and that would save the long-term care homes a bunch of money. But then that is like the worst case scenario for spreading COVID.
And other communicable diseases in the future.
Yeah,
I'm sure that's
like
not-
even the flu going through a care
Yeah.
home will kill 5% of your residents.
I was gonna say I'm sure that's not great for flu season. Even like year after year, just having a lot of shared staff between care homes seems
Yeah.
like a bad idea for every flu season.
So there's a lot to consider. It's like a whole nother topic when you get into that sort of healthcare. But
It's
that is
almost
a
like
scary.
healthcare is extremely complicated.
Well, it's a scary cost because I think in Japan it's 4 times, no, it might even be 5 times the cost per year in healthcare for people over 65 versus people under 65.
That sounds like very reasonably like accurate. Like
Yeah, like somewhere around 5 times, and it's
your
like,
elderly are just gonna suck up so much more resources.
and so as those people become the largest segment of the population, like Japan's rising healthcare costs are pretty much attributed to that.
Yeah. Do you guys have any more things to add?
Nope. The only thing I studied was the Netherlands, but it's a little bit the same as like the other ones. I don't think it's really worth going into.
I mean, I wouldn't mind giving the brief overview of China because it's almost like a bizarre world.
Yeah, that would be kind of,
Like-
I think, fun.
The Chinese love their idioms. Like their language has a lot of idioms, so I'm always very impressed by translators that manage to make Chinese understandable in English, because you have to know a ton of English idioms and a ton of Chinese idioms. But one of their idioms is that no doctor's child becomes a doctor, because in China the profession is neither prestigious nor well paid, with senior doctors earning roughly $14,500 US a year.
But when they come here, that's what they become.
Oh, well, yeah, because it's a prestigious position in
Yeah.
the Western world.
But it's just
But
not
in
there.
China, it's not. And in China, there's effectively an epidemic of violence against doctors, where
Yeah,
It's,
this is spicy.
yeah, this is a really weird one. They have a word, not even an idiom, a word for it, which means medical disturbance, which causes people to act violently towards doctors. And it is 85% of doctors have encountered violence at work, with in 1 year more than 60,000 disputes making it to their arbitration
why?
for violence. It's just part of their culture.
They just
is
don't trust the doctor. Like if something goes wrong, they blame the doctor solely for it, even though it's like the person was.
Yeah,
fucked
like
regardless.
they become enraged with their medical care, and
Seems like a good way to
take it
keep
out on
your
the
medical
doctor.
care in the fucking like low end.
so when China brought in their universal healthcare regulation, it specifically included a clause making violence against doctors illegal,
Fuck.
which is just not something you expect to have to be included when you're making a universal healthcare declaration.
Yeah, that's so strange. Like, what are their outcomes though? I didn't study China at all, so I can tell you shit.
Their outcomes are not good. Basically, they have less doctors than most other countries near their income level, at 2.6 doctors for every 1,000 people. But the WHO looked at it and they said half of the doctors don't even have a bachelor's degree. And that bachelor's degree isn't a medical degree either. And so they don't specify how many of their doctors
Yeah,
actually
but
have
like,
a
are these
full
doctors
8-year
practicing like
They're
Eastern
they're
medicine,
doctors
or
in
are
the
they-
same way Dr. Evil was a doctor. I think that's pretty much thing.
Well, they're doctors. They treat patients in the same way that doctors in the Western world treat patients, but it's
It sounds like the old barber
Yeah, barber and surgeon combo,
surgeon combo back in the day.
or barber and dentist.
I'm a doctor.
well, so they're doctors in rural villages. 0.2% have a bachelor's degree, and then in villages, or in townships, it's less than half have a bachelor's degree. It's only when you get to the cities that you ever run into people with medical degrees as well. And that leads to a case where a lot of people searching for good healthcare will go into the cities from rural areas, which puts even more strain on a lack of doctors for the cities.
You don't want to go to, rando with no degree whatsoever for your healthcare. Shocking.
And then their out-of-pocket costs before their universal healthcare were about 60% of medical expenses. And so now they've got about 95% of Chinese are covered by their current healthcare system. So it's not quite universal, but almost. And their average is now 30% of their medical costs are paid out of pocket, which is still plenty enough to bankrupt almost all of these poor rural farmers that are trying to get good healthcare. Even during COVID, in the early days of COVID, like January, February, there were people who died from COVID because they left the hospital since they couldn't afford to incur the costs. And then the Chinese government decided in late February that they would pay all of the costs for COVID-related coverage.
Sounds like the CCP needs to mandate some more doctors into existence.
Oh, the other weird one is that out of their actual doctors, only 5% are general practitioners, whereas an average country has 23% general practitioners. So they have almost no like family doctors.
It's like basically specialists.
Yeah, which I imagine is probably due to the fact that their quote unquote family doctors would be the ones that have no training, medical degree. And then there's a shortage of nurses where the average is that they only have one nurse per doctor, and the average in developed countries is to have 3 nurses per doctor.
And they already have less doctors.
Yeah, so they have less doctors than most places, and then they have way less nurses.
That's brutal.
So yeah, it's kind of weird in that they are basically single-handedly dragging down the correlation between healthcare and GDP growth, I would imagine, because they've had quite impressive GDP growth, and they seem to have lagged significantly on keeping their healthcare up with what their GDP would suggest their healthcare should be around. Like, they're much below their peers.
Well, that actually, I can just add a little bit from, there was a individual, Zeke Emanuel, I think that's how you pronounce it. He wrote a book on world's best healthcare, and they only looked at 11 countries in his book, but he did rank China dead last, number 11. I didn't read the book. I saw an interview with him, and he said, yeah, not good. Interestingly, though, he did put Taiwan in the top tier out of the 11 they studied.
So the real China.
Yeah, the actual China. So it is interesting that, yeah, Taiwan he considers it to be very high quality healthcare, but mainland China, not anywhere close in terms of quality of care, which obviously is mirrored in a lot of the other trends like per capita income and all that stuff. But so yeah, they lag heavily. So,
and another aspect of negative health outcomes for the Chinese is their pollution, where there's an effort to analyze health outcomes and pollution in both short and long term based on credit card spending and debit card spending, because people have to pay part of their medical fees so they could track these things. And in short term, when the pollution went up, healthcare spending went up, and necessity and supermarket spending went down. And in the long term, that effect was only exacerbated when the pollution lasted for longer. And the Chinese spend billions of dollars a year on masks to cover their face and hopefully filter some of the pollution out in the major cities. Like, it's just, it's actually a health crisis, effectively.
Well, anyone who remembers the Beijing Olympics remembers that well. They had to shut
down all their coal generation plants, and then they tried to
industrial
scrub the
production
air
for like months.
Yeah,
just to make it like survivable for athletes.
For the athletes, yeah.
It's so brutal. Yeah, that's
well, a lot of
interesting.
athletes just weren't gonna go. They're like, I'm not risking that garbage. It's not worth it.
Oh, there's a company in Alberta that sells bottled air from the Rockies to China.
Yeah, I had heard about that, actually.
What?
Yeah,
really,
it's like a
really,
little
really
bits
wanted.
of Albertan air.
I thought that would be like a good thing to start up a Vancouver one of those, because it's, especially since Vancouver has recognition.
But then you're just
Everyone wants
selling
to
China.
sell me
Then
air.
you're just selling Chinese air to China. Then what's the
They
point?
don't know that.
Yeah, they do. They know Vancouver's fucking China West.
Yeah, Vancouver's actually not even exotic for them anymore, probably.
That's true, but
It's
you have to
just-
go out somewhere else.
It's just Hong Kong 2.0.
No, it's mainland China.
True. Anything? I don't have anything else really.
No, me neither. I think that's all I wanted to chat about.
Yeah, that about sums her up.
Alrighty, well, thanks everybody for listening.